Okay.
Are we live?
We're live.
Okay, good. All right. We're here with Fiona. That's not a real name. That's your fake name. Fiona, thanks for allowing us to video this little experience, this encounter. Okay, so we're just talking. Fiona was in about a month ago, right?
Yes.
And I diagnosed you with phlebitis.
Yes.
You had some phlebitis. We put you on some steroids for a little while.
Yes.
And you may or may not have gotten a little bit better short term. Is that correct?
Yeah, it helped the pain.
It helped the pain. And then things sort of got worse again.
Yeah.
And I was talking to you about phlebitis and how long it can persist. And many of my fans on YouTube know that that I just recently had surgery 2.5 weeks ago. And I keep bringing this up, and I don't mean to, but it's interesting in this particular case because we're talking about phlebitis, and I've developed a little phlebitis. And I want you to feel the veins in the back of my hand there. Now that felt pretty soft, right?
Yes.
Now I want you to feel right over here. What's the difference?
It's hard.
Yeah, the vein right here is very firm.
Yes.
And it actually is quite painful. It's getting more painful, and you can almost see it's a little
color.
bit red right there.
Yeah.
So what's happened to me is my IV site has become inflamed, and I've developed phlebitis. Okay, so phlebitis can be quite common. It can be caused by lots of different things. You had it on your leg down there, and the initial spot where you had it has gotten better, but it's moved, hasn't it?
Yes.
So you're feeling it down here?
Yeah, here, and it'll go in my toes also.
Mm-hmm.
And by the end of the day, this right here will be swollen out to here.
Mm-hmm.
And this, I can't wear shoes or anything.
Mm-hmm.
It hurts to walk.
Okay, and do you have any swelling right now? Let's
no.
push. Let's do this. This
Okay.
is the
Ow,
common
ow.
Okay, that hurts. And you are retaining fluid. Okay, so that when it hurts like that, that tells me usually there's fluid in the interstitial space. That's the space in the skin outside of the vasculature, and the fluid's in there in the milieu, so to speak. It's in there, and we need to get you on a little diuretic. You're retaining a little sodium and fluid, and that's not uncommon, especially in women. It's a girl thing, more often than a boy. What do you mean, I'm trying?
Being sexist.
No, this is not sexist. This is medicine.
Sure.
We should trademark that term. It's not sexist, it's medicine.
Right.
Right. Okay, so you've got some phlebitis, but I don't think the phlebitis is as bad. I think you're feeling a little of the discomfort from some of this peripheral edema you're experiencing. Does this hurt over here?
Nope.
How about right across there?
Nope.
And there?
Nope.
But if I push on it like that,
Yeah.
that hurts.
It feels like you're hurting my bone.
Mm-hmm. How about the other one? Let's see the other side. Do you eat a lot of salty foods?
Yeah.
All right, now this is a little varicose vein you have there. That's not sore, is it?
Sometimes.
Sometimes that does. And again, you have a propensity to have a little phlebitis. You may have a little bit more of an inflammatory condition going on. How about if I push there? Does that hurt?
Yeah, but
Little bit.
not like there.
Not like that.
By the end of the night, by tonight,
Mhm.
my legs will be numb up to here.
Up to there. Okay.
And it hurts.
It hurts. So we have some things going on. We may have a little circulatory issue we need to work on here. I think we need to get some studies done on your lower extremities. We need to find out if you have some occlusions or anything like that occurring. We need to get you on a diuretic to help get some of this fluid off. We're going to use triamterene hydrochlorothiazide. It's a combination diuretic, and it's potassium sparing, so you're less likely to get low potassium on that. We're going to put you on another round of steroids to help with the underlying phlebitis that you have on the right, more so than the left. What do you think of all that?
Okay, right here,
Mm-hmm.
I get a lot of pain.
Mm-hmm. More so in the last month, right?
Well, do you want to know about how this started?
Sure, go ahead.
Okay.
We love it.
This first started when I first started I would lay down to go to bed, and I would get from here, I could feel it coming from right here, shots of pain through my whole body, And then I was sent to the vein specialist.
Oh, good. Okay.
And they measured my veins, and I have, after a while, I just thought it was something from getting older. Okay, and then it started happening when I would get out of bed. I would feel shots of pain coming up, and that's when I went to the doctor. They sent me to the vein specialist.
Right.
The vein specialist measured my veins, and they're supposed to be 0.60, and 3 of mine are 2.2. The valves aren't pumping the blood up, and instead my blood is falling down.
Right, it's pooling.
Yeah, and it's pooling right around here.
Okay. And so when you anytime you have a venous insufficiency like that, then what can happen is you can get inflammation and you can get the phlebitis. What can they do? Did they say they could do anything about the veins?
Well, they said they wanted me to get I don't remember the exact word, but I'm thinking it was a stent.
Right.
And then where they in 3 of my 3 different parts.
Okay. So what I was saying earlier about checking your veins. You already confirmed this has already been done. You have venous insufficiency. Your body is not doing a good job of returning the blood back from the feet and the lower extremities back up into the rest of your body. As a result, that's contributing to the fluid retention in the lower extremities. So we still need to have that done. We need to get you back. I know it's a money thing. Okay, so we know why this is happening.
Yes, sir.
So we can treat this with diuretics and we can help with the inflammation. And down the road, whenever possible, we'll hopefully get the veins treated and opened up better so that you can get better blood return back to the body.
Okay.
How's that sound?
It sounds good. The reason I'm here today is
Yep.
because now because of this, I've had an uncle that died of blood clot.
Okay.
My brother has had 2 emergency surgeries because of a blood clot.
Mm-hmm.
Tonight I'm graduating tonight from Lone Star.
Mm-hmm.
And I'm going to be standing for hours.
Mm-hmm.
And then after that, I'm flying to California. And this is where everybody's concerned. They say on the flight that a lot of people die getting blood clots.
You're worried about getting a blood clot.
Yeah.
Okay, so what you're going to do in your flight is you're going to get up about every 30 minutes and you're going to take a walk up and down the aisle and sit back down.
Okay.
You're also going to work on squeezing your calf muscles.
Okay.
Okay, put a good squeeze on them. Okay, you can do this yourself.
Okay.
All right, you can squeeze them. We can get you some compression stockings that you can wear. That will help. You can also start taking a baby aspirin every day. That can help prevent clots too. Now,
Okay.
everybody 40 years and older, unless you have a contraindication to do it, should be taking a baby aspirin every day. It reduces your risk of blood clots, stroke, pulmonary embolus, deep venous thrombosis, that's a blood clot, and it also reduces your risk of colon cancer, and if you're a man, it helps reduce your risk of prostate cancer. And all this has been proven. So everybody 40 years and older should be on a baby aspirin once a day. So in your case, I truly recommend it. I still think, though, since you're having so much inflammation down there, we should give you a little steroid pack as well today.
Okay.
But I think we'll get you to your trip. I think you'll do fine.
Yeah?
Yeah.
Okay. After I took the steroid pack last time, and I called back and I got another one. Okay, I waited like 5 days out. Well, I called and
Okay.
And then they sent another one to the pharmacy, and I took another pack.
Okay.
By the end of that time, I was like a crazy person. I was ready to kill people.
Okay, well, we need you not to kill people.
I know.
I know. There's a steroid rage can happen even with glucocorticoids. That's right. So I'll give you something to help with that.
Okay.
I can give you some medicine to help with that being on edge.
Okay.
It's just temporary. It's just a little while. That's actually a pretty common side effect to the steroid. Yes, it is.
Okay.
Yes, it is. So that's also for everybody to know. If you take a steroid pack, you can be aggressive. It can make you more aggressive. It can make you more on edge. It can make you less sociable. You'll find yourself apologizing a lot being on steroids. Yes,
sir.
You understand. Okay. All right. Good
Okay.
deal. We'll fix you up.
Okay.
Thanks for sharing with us.
Thank you.
All right. You're welcome.
All right, guys, watch the Meta 7 video, guys.
We roll. We don't give people time to prep at all.
All right, got it.
Tell us about Meta 7.
All right, so I got on Meta 7, and within a couple days, I could feel the energy already starting to go up. At work, my concentration was better because I have to pay attention at work. I have to focus, extremely focused. Then afterwards, I have school, college. And when I ran out, I noticed a big difference that my energy level went back down to what it was before. And
Because you ran out, right?
I ran out and I
Yeah.
was sluggish. And so it's worth every penny. And I back at 100%. I've lost weight on it. And that's it.
Awesome. So we're re-upping today, right?
We are re-upping today.
Getting you another bottle today.
Have to.
And now, have you been compensated in any way for this
No.
testimonial?
No, not at all.
Good,
no.
don't ask because I'm not paying you nothing.
Oh. You know what? I'll lose weight. I'll pay for it.
No, it's a good product.
Losing the weight and being able to live like with less
Right.
jail around my body,
Right.
you don't have to pay me.
Right. Now, the energy that you feel, do you feel jittery and shaky like
No.
caffeine or something?
I wouldn't take it if I did.
No, it just makes you feel naturally,
Just have more energy, like
clean.
clean. Yeah,
Yeah.
exactly, clean. Almost like a B12 type, but better because I've taken just straight B12 and it hasn't worked for me. Like I've taken the liquid B12 and so whatever's in it
Okay.
is worth it.
Is it true I'm your favorite doctor?
Oh, Dr. Gilmore's my favorite.
All right, thanks. Bye.
Bye.